Welcome to Fort Worth 148's podcast, where we meet to discuss Masonic topics and strive to build value in the Brotherhood. The opinions and statements of the participants do not represent any positions or stance of any Grand Lodge or Lodge and are solely the viewpoints of the participants.
Welcome, brethren, to the Fort Worth Masonic podcast. Today, actually, it's just going to be myself having a one-on-one conversation with our longtime friend, author, and all-around great guy, Brother Chuck Dunning. Brother Chuck, thank you for agreeing to join me for this episode. Now, to be honest, today's topic is not going to be on contemplative masonry, which is something that we've had you on the podcast before. But today, we're really going to focus on mental health. Brother Chuck, would you mind giving us your background on the subject?
Yeah, absolutely. So I am a licensed professional counselor in the state of Texas, and I have been working in mental health in one form or another since about 1988, well before I became licensed. I started working in transitional living facilities, or what we might call halfway houses, for people who were trying to move back into a more stable life that had had some sort of a serious disruption in their life. I've worked in community agencies. I've worked in hospitals, outpatient treatment centers, private practice, and on a college campus, doing different things in mental health. Not all of that has been counseling. Some of it has been mental health outreach and education. And some of it has been mental health consulting work. I've served as an adjunct professor for the counseling education program at a local university, and did supervision of students who were working on their master's degrees in counseling. So I've got a pretty broad background in mental health.
All right. That's one of the reasons, knowing that background is one of the reasons why you're the first person I reached out to say, would you like to talk about this subject?
Well, thank you.
So I think a lot of us would have to admit that the past couple of years have been challenging for a variety of reasons. Illness and death have impacted most of our lives on one level or another. Economic pressures have increased stress levels, and at times it may feel like things are a bit overwhelming.
Mm-hmm.
So as we were talking about previous to us starting the episode, the two major issues that a lot of people may be dealing with are depression and anxiety. First of all, I guess let's get into the definition of what is depression.
Mm-hmm. Yeah, depression is a pervasive disturbance of one's mood in which there's just a loss of the ability to enjoy life. There are lots of different ways that depression can be defined, but I find that to be one of the most simple and to the point ways of thinking about it. It's just the inability to enjoy life. Now, that, of course, is not an either or thing. It's not like you either enjoy life or you don't. Most of us are on a continuum somewhere between really thoroughly enjoying our lives and just thoroughly not enjoying our lives. And we fluctuate back and forth between those two extremes, most of us to some degree. But people who are experiencing depression tend to find themselves more on the lack of enjoyment side and find it difficult to move out of it. And so that's, I think, a basic understanding. And then, of course, we probably need to differentiate between what we might call, in common vernacular, between clinical depression and what some people might call situational depression, right? So there are going to be times when any normal human being is going to be sad, is going to think, man, life is just not really good right now. And and to go through those kinds of phases is not necessarily an unusual or even an unhealthy thing. Sometimes that's appropriate. But when we start moving into concerns about a person's overall mental well-being and how they're able to function in life, then what we're seeing is kind of a pervasive pattern of the just, no matter what they do, no matter what sorts of things they're engaged in, it's just not what it used to be for them or what they want it to be. Food doesn't taste as good. Jokes aren't as funny. Being with the people that they love doesn't bring them the joy and pleasure that they want it to, and that this just continues on and sometimes gets deeper and deeper and deeper. So I think we need to distinguish again between those two different kinds of what we typically call depression.
Okay. And I know there are different types of depression, even if it's clinical, right? Manic depressive, major depression, and each of them have, I guess, kind of different signs and ways that they manifest. So moving to anxiety, what would be the definition of anxiety?
Yeah. So anxiety, I'll try not to be too clinical, with my language here, because it can really be easy to get hung up on these terms. Anxiety is a pervasive condition in which a person, if we're, again, talking about it in kind of a clinical sense versus a situational sense, then it's a pervasive condition of kind of like worry, of that agitation, that concern that things are not going to go well, that things are not going to go right. And there's this constant state of vigilance and the tendency to overreact is one of the symptoms that often goes with anxiety, to have inappropriate reactions for the circumstances or overblown reactions for the circumstances. And when we talk about worry, a common way that this is experienced is continuously repetitive thinking about something and just going over it and over it and over it, and not seeming to be able to really control that pattern.
Almost like a fixation.
Yes, kind of like that. It kind of shares some qualities with obsessive compulsive disorder, but it's not exactly the same thing, because obsessions and compulsions may not necessarily manifest in terms of worry. Mm-hmm. And with anxiety, that's what we're seeing is that, and it may not be worry about anything in particular. It's just a generalized state of worry, so that everything kind of becomes an object of worry. And I think that in layman's terms, that's one of the easiest ways to understand what anxiety is and how most people would experience that.
Okay. So it sounds almost like one's almost kind of a descent, right? A downward spiral, I guess, into the doldrums, if you would. And the other one sounds almost like an escalation, that a heightened sense of awareness that it's a building up as opposed to descent.
That's very often true. However, sometimes anxiety, if it continues over a prolonged period of time, can actually lead a person into depression, and therefore a person may be misdiagnosed if they go to a mental health professional, or if they're trying to diagnose themselves. Let me just state right now, for the record, to everybody, nobody needs to be in the business of diagnosing themselves. Even people who know diagnostics very well don't need to do that. But see, what happens sometimes with anxiety is you get so worn down by this constant worry and this constant apprehension that something terrible is going to happen, or that, everything that you try is going to be a failure, or that, all of these things can wear you down to the point where you just sink then into depression. Mm-hmm. And if you don't recognize that that's where the depression is rooted, then sometimes the things that might be done to try to deal with the depression may not be effective and might even contribute to it.
Okay. So I guess exploring that a little bit more, how are depression and anxiety different? I mean, we talked about how one may lead into the other, which is kind of the interaction between the two of them. Mm-hmm. But I guess, how can a person distinguish between the two of them?
Yeah. It can be really tricky. Okay. And that's why I was saying is that once anxiety really wears a person down to the point where it starts to manifest in depressive ways, then being able to tell the difference can be very, very difficult. Mm-hmm. When depression is really kind of going on its own and is not interwoven so much with anxiety, you don't really get a lot of that worry aspect to it. For a person who's really deep into depression, or just not necessarily super deep into depression, but a person who's just experiencing depression and depression alone, there's often a kind of disinterestedness. And unaffected, just kind of seem to be unaffected by things that are going on around them. And in mild cases of depression, that may be the first sign, is that they just kind of seem to be kind of blasé about things. They don't really care too much one way or the other. And you typically don't get those symptoms with anxiety.
Okay. So hearing about that, it reminds me of like Eeyore from the Pooh stories.
Yeah.
I don't know if you've seen Men in Black. In the beginning, the character that he's at the farmhouse and the alien spaceship crashes into his car and he walks out and his only response is figures.
Right. Yeah. This is not someone suffering anxiety.
Right.
Yeah.
So what are the signs that we should look for either depression or anxiety? I guess how can we be aware of it, I guess?
Yeah. Well, in both cases, I think the first things that we want to be aware of are certainly internally, just our own sense of, do things seem right in my life right now? Is my life what I want right now? Now, that's not to say that, a person who's being completely honest with himself and doesn't have depression or anxiety won't say, no, there's some things I'd like to change about my life. In fact, I think most of us would say that. But that deep sense of like, okay, given everything that I understand about what's going on in my life right now, do I feel like that things are pretty good and I feel pretty stable and things are going okay? And if that's not there, well then, okay, maybe we should look a little deeper. Also, the people who care about you, what kind of clues are they giving you, whether it's verbal or nonverbal? How are they acting around you? Are they treating you differently in some way? Are they specifically telling you that they have concerns about what's going on with you? We need to listen to those things too. We also need to look at just the patterns of self-care that we have in our lives. Often what goes with either anxiety or depression is that the things that we need to be doing for self-care start to fall away. Because so much of our energy and anxiety is going into focusing on these other things around us and trying to deal with them and have, to control things and keep them in order and be prepared for whatever it is that might happen. That takes a lot of energy. And so it takes away from our ability to focus on self-care. And with depression, Self-care tends to take a back seat because we just don't care. We start losing, one of the first things we start losing care and concern about is ourself.
Okay. So, I mean, and so I guess looking at it that way, if someone perhaps, was pretty well put together and you see that they're starting to ignore, the way they dress and it may be just they didn't have time, they were running from somewhere else. But if it is a consistent pattern that shows a very real change in behavior, is that something to look out for? That
Yes.
okay.
Yeah, and I think this is important because we've already bridged from just a person being aware of their own condition now to what about being aware of other people? And so there's so much there in relationships that are important for our mental health. I think in our society, we often get the message that to be a well-functioning individual, we have to be like super independent. And we even automatically connect words with that image like strong, and yet that's not the way we evolved as a species. We evolved as a species by being able to have empathy and care and compassion and to collaborate and cooperate with each other. And, here's a great point in Masonry. What are our principal tenets? Mm-hmm. Brotherly love, relief, and truth. And those are the things that there's a reason they're our principal tenets, because those are at the foundation of our well-being as individuals, as communities, and as a species. Mm-hmm. And so if we're really concerned about being a strong individual, then we can fail to listen when people are giving us important feedback, whenever they express their concerns about us. We can fail to reach out for help when we know internally that we're struggling. We may even deny to ourselves to some degree that we're struggling. And it can even cause us to maybe not offer to help to others when we see that they're struggling, because we think, they need to be a tough individual, or they're trying to be a tough individual and I don't want to, get in their space, and so that's just something we need to rethink very often is, does that idea of being tough and strong and independent, is that always appropriate and helpful?
Well, and in a way that almost seems like it could be a potential conflict between the Masonic dictates, right, that we're all taught, and societal norms, in that, in society today, everyone is expected to be an island, right? That,
yes.
And you even hear it in the language, right? Be a man, or suck it up, or,
mm-hmm.
To be a little bit more crude, sack up,
Yeah.
But I mean, that has
right.
entered everyday parlance, and you can hear it even in the schools.
Yes.
So I guess in a way that could also exacerbate the issue a little bit and make it even harder to either recognize it or to accept it if you're dealing with it in yourself.
Yes, for sure. Yeah. So, but this is just one of a number of kind of common issues that we have in terms of how society affects us. Mm-hmm. There are some ways in which certain stereotypes and certain things that are part of popular culture are not really healthy for us. And it's really easy for us to get caught in those things. We've just been talking, for example, about how some of us are really strongly conditioned to be strong, independent, self-made, right? Mm-hmm. Which is absolutely ridiculous. None of us are self-made. And so that's just one example, but certainly social media, and the way that the platforms of social media and the algorithms that they use to bring things to your attention are actually designed to play upon some of the less healthy habits of human thinking, like anxiety, um, and and our insecurities. And anxiety and insecurities are often very deeply linked with each other. So those are things that we need to be aware of and need to be part of our self-care, is understanding what sorts of social interactions are actually healthy aspects of our self-care and what sorts of social interactions are not.
All right. So one of the questions I wanted to ask is everybody manifest, I guess, issues in different ways. Are there different ways that men exhibit signs usually? Again, this is just broad generalization. Are there different ways that men may exhibit signs of depression or anxiety when compared to women?
Yeah.
Also, how do we recognize the sign in our children, our teens?
Yeah. Well, one of the first things that I wanted, let's just start with a very general thing, and then I really want to get to your point about differences between men and women.
Mm-hmm.
First thing is, I'll go back to restate something you said earlier, and that is anytime we notice a significant mood or behavior change that seems to like not just be a passing thing, then that's probably a clue that we need to follow up with someone. Whether it's something we notice in ourselves, indicating that we need to follow up on our own self-care by reaching out to other people, or whether it's something that we notice in others, like our children, right? Some of that can be developmental, of course, with children, because they're going through rapid physiological changes in their growth process, and that has significant effects on their psychology. Mm-hmm. And so some of that may be normal and developmental, but it may not necessarily be. And so just being mindful of that is important, and being educated, trying to be as informed as possible, and having good resources available. If you think there might be a problem, who are you going to go to? Having an idea of who you might go to as a professional is an important thing. Now let's get to the male and female question. I appreciate you saying that we're talking in broad generalizations here, because we are. These things can be radically different from one individual to another. But in general, our society does tend to enculturate men to behave in certain ways and women in others. And there may even be some biological predispositions there. We know that the hormones testosterone and estrogen affect people differently, and not just physically, but psychologically. So what we see typically, and what would be a stereotypical male response, is to not express emotion. Even, if we're not being depressed or anxious, a lot of times we've been taught just to not express emotion, to be reserved, more reserved about emotion. We don't have the kind of permission culturally to be emotional beings the way women do.
So we're expected to be stoic.
Yes, that's a good word. There's that ideal. Not to say that there aren't plenty of women who that's true for too. And it can differ about which emotions are acceptable. So, for example, anger is an emotion that's much more acceptable for males to feel, acknowledge, and express in these generalizations than for women. Sadness is the other way around. Helplessness. It's definitely more acceptable for women to acknowledge within themselves, to voice, and to seek help for feelings of helplessness than it is for males. And so when a woman is depressed, we might see more overt signs of sadness from her.
Mhm.
We might hear her more often saying, I'm depressed, I'm sad, life is no fun anymore. I'm not happy. Really just really clear statements. When a male is depressed, we just might not hear anything from him. We may hear even less of him saying that, I feel happy or I'm having a good time. So rather than the presence of statements to the effect of being depressed, we have the absence of statements to the effect of being happy.
Mhm.
And, but like I said, even that can be tricky with males because some males are heavily conditioned to not even be overt about their own sense of joy and happiness in life.
Okay.
They're too busy trying to have this misunderstood idea of what it means to be stoic.
Well, and it sounds like maybe that's one of the issues that we have to deal with when trying to recognize that issue in ourselves is that for men and women and even children, we are comparing ourselves to a societal ideal
Mm-hmm.
that this is how we're supposed to be, this is how we're supposed to act.
Mm-hmm.
If we don't act that way, then we just need to kind of be quiet and force ourselves to act in that way.
That's it. Yeah, you're absolutely right. So, for example, some people, when they are expressing great joy and happiness and everything seems great, that's actually a symptom at a deeper level that they're not happy because they're really trying hard to overcome that it's kind of like a fake it till you make it kind of approach, right? And so again, it's like, is there a significant behavior change? If that person all of a sudden is acting like they're just the happiest person in the world, but nothing really seems to have significantly changed in their life, then that may be an indication that there's something not happy going on under the surface.
So denialism or maybe even and it sounds weird. I've had friends who have committed suicide as I've lived my life. And there are some people that I have known that they seem to be at their happiest right before.
Mm-hmm.
And sometimes that's a sign, and I didn't know this at the time when I was younger, but sometimes that's a sign that they have made a decision and they're happy because they've finally figured out, I guess, a way to kind of get off the ride. And
Yeah.
so either they're trying to throw people off the trail or they're legitimately found joy in the fact that I've decided.
Yeah, there's a kind of relief and peace that comes to some people when they've made that decision. Yeah. And you're right. Sometimes it can also consciously be an attempt to make everything seem okay so that somehow that makes it easier for them to follow through.
So we've discussed that not everybody will experience these symptoms in the same way,
Right.
even within the same gender or the same age group. Is it possible to overlook these signs in ourselves? And I know we've talked about denialism, but what signs are there that we should be concerned in looking closer at ourselves?
Yeah, good question. We can overlook the signs in ourselves, but here are some basic things. I talked earlier about self-care. And so one of the first things that we do when we start trying to gauge where a person is in terms of their well-being is just look at the basics. How are you sleeping? That's often one of the first questions that I ask people. How are you sleeping? Are you getting good quality sleep? How much of that sleep are you getting? Is it routine? Do you have a stable routine for sleep, or are you getting sleep at odd times and different hours and so on? Mm-hmm. Has there been a change in a person's sleep pattern? And how long has that change been there? And, did it gradually build over time? Those are all important things. But sleep is a really important one. There's so much of our mental health that depends upon getting good, consistent, quality sleep. It's just amazing how many people that I have worked with over the years that when I ask that question and we start examining their sleep pattern and they just focus on changing that, how much that can improve the quality of their life. So there's one. Another thing is, tell me about your diet. How are you doing with your eating? And, are you getting a genuinely nutritious diet? Or are you relying on junk food? Are you getting lots of sugars? Are you, consuming lots of stimulants like caffeine and the things in energy drinks and stuff like that? Those things generally have very detrimental effects. Sugar, caffeine, and the stimulants in energy drinks are all really bad for us. But because we're out there trying to be strong go-getters, those are often the things that we rely on to provide us energy. And one of the effects that those things have is that they can disturb our sleep patterns. Alcohol is another example. THC, marijuana, can also, it definitely can help some people fall asleep, but it also has been shown to interfere with those deeper sleep cycles that we need for that really restorative rest from good quality sleep. So a lot of the substances that we use as part of popular culture to help us, get things done in life are actually detrimental in a larger picture to our well-being, and over time will definitely cause problems for us. So sleeping, eating, and then the other big one is what kind of physical activity do you have? Are you moving your body? Are you getting your heart rate up? Are you getting outside and getting sunshine and seeing green plants? There's actually emerging research. I did a panel discussion online about this at the very beginning of the COVID pandemic, about how just seeing the color green has really positive neurological effects on us. And so there's all kinds of benefits to being outdoors. Mm-hmm. And so the big three there are diet, exercise, and being and outdoor activities, and sleep patterns. So those are things that I would look at.
So it sounds almost like you should try to be aware of disruptions, whether it's with your diet, with your exercise, with your sleep. And it sounds also like those can also kind of not only be the symptoms, but the triggers for some of the people that people experience.
Absolutely. You put your finger on it there. And I would just say a caveat on use of the word disruptions there, because a lot of people have grown up in families where there hasn't been good attention to those big three things of self-care. Mm-hmm. And so they've learned patterns as children that are horrible for their well-being. And so there's no disruption for them. They're just living life what they think is normal. And so a little bit of education may be necessary with some of these people who, don't realize what they're doing to themselves.
Right. Okay. And that makes sense. You may think everything's just fine, and but because it's learned behavior, you're just not realizing the detrimental effects it can have on yourself in your psyche.
Mm-hmm. For sure.
So I guess the question is, so we know that we can overlook it in ourselves. Would we apply the same pattern of investigation if we suspect it, that there something just isn't right with others. How do we recognize it in those that we care for,
Yeah.
whether it be friends, family?
Yeah,
What do we look for?
yeah, that's the same thing. We do want to look for changes. We want to look for um, what are the persistent patterns in mood that we see. Um, and again, if if your relationship with someone has been that they're always a certain way, and that's the way you've come to know them, and that seems like a stable part of who they are, then you may not recognize that that's an ongoing symptom of a pervasive state of, for example, depression or anxiety. Um, we just might take it as part of their personality and not recognize that there's really something deeper going on there. Because sometimes people do have personality traits that tend to look a little more like anxiety or look more like depression. But that we shouldn't just write that off as, oh, that's just who they are. Mm-hmm. Having the care and the courage to actually speak up to someone and ask questions, caring, compassionate questions, is one of the most important things that anybody can do to be a good friend or a good family member. And we don't train ourselves in our culture very well to do that.
So those questions, I guess, can they be phrased in a non-invasive way, right? Like just simply, how are you doing? How are things going?
Yeah.
How's the family? Are those things how we can do to try and help, I guess, gauge and better understand
yes.
someone struggling?
Those are often the lead-ins, but of course, it's really easy to deflect. How are you doing? Oh, I'm fine. Okay, great. That, and that's where it stops. But if you say, how are you doing? And the person says, oh, I'm doing okay. Then you might come back with, well, recently I know that this happened, or I've seen this going on. What about that? Mm-hmm. And so it's not necessarily like you have to ask the person, are you depressed? You can ask them just what's going on, but in more specific manners, referencing certain things that you're seeing in their mood or behavior. Now, this, of course, brings up a whole other thing, and that is if you are genuinely concerned that someone is suicidal, how do you deal with that? Mm-hmm. Under those circumstances, it's very important to be direct, really direct with your questions. You need to be less concerned with offending them or being off base, less concerned with offending them, less concerned with mistaken than you are concerned with their well-being.
Okay. So there are times when you may have to be more direct.
Much more direct. Yes. Yeah. It's like, what's going on with you? Well, I've not been too happy lately. And okay, well, tell me more about that. Well, I've just been thinking that life isn't really, what I thought it was going to be. And sometimes I don't even want to be here. Mm-hmm. Okay, wait a second. When you say you don't even want to be here, does that mean like you think you would be better off dead? And the next answer is, well, yeah, sometimes I do feel that way. Okay. Are you having suicidal thoughts? Are you thinking about killing yourself? And so being that direct, not say, are you thinking about hurting yourself? Are you thinking about ending it? Because when those questions are that indirect, it provides a little wiggle room. But when you're really direct, are you having suicidal thoughts? Are you thinking about killing yourself? The wiggle room goes away. And if you see any hesitation or hear any hesitation in a person's voice at that point, then there's more going on. And it's time to step up your responsibility as a friend or a family member.
So if you suspect that, kind of eliminate those easy off ramps to the conversation and just be direct.
Right. at the risk of being wrong, at the risk of the other person saying, "Oh my gosh, no," and no, don't let your own well, there's a new campaign that I've seen, Embrace the Awkward, or something like that. I've forgotten exactly how it is, but it's that idea. You recognize your own feeling of awkwardness about getting into this with somebody. Mm-hmm. Go with it. Take the energy of that awkwardness and use it as drive to do what you know is the most caring thing.
Well, and I guess that's the key of it, right? Is that if you do care, you do need to kind of push yourself to be awkward if you really have that level of concern.
Yeah, exactly.
Well, and so I know too, I guess the use of social media sometimes, I've seen things that people have posted before, and especially things that people post that just send off alarms and then they delete it. If we see something like that, I guess, is that something that we should be aware of? Because sometimes you'll see people post, like, oh, things are so bad right now. I'm not sure how much I can take. And then they go back and delete it, right?
Right.
In that case, I guess it feels like it would be acceptable to say, hey, I saw you posted something. Are you okay?
Yeah. Yeah, I think acceptable or not, it's the loving thing to do. And very often what happens is that even if a person feels embarrassed by the thing that they have posted and they don't want people to worry, and they feel kind of ashamed and they regret that they caused anybody else concern, still it's going to be impressed upon them that you care. And knowing that there are people out there who care about you is one of the most important things when it comes to being able to work through our mental health issues, whether it's depression or anxiety. Knowing that you actually have a support system that isn't just passive out there waiting for you to ask for help, but that is going to reach out for you and ask if you need help. That kind of support system is vitally important.
Now, is there a risk of backlash that, and how do we deal with that, right? Say we have a friend that we have concerns about, and when we ask them, they almost take it offensively because, again, we're kind of ingrained that we're this stoic individual. Don't even ask me about my feelings.
Yeah.
Is that still okay in the long run?
I think it is. And I think anybody who's honest needs to understand that the risk of a person's life is much more important than a temporary flare-up, a temporary conflict or misunderstanding in a relationship. And I think that's just something we need to remind ourselves of in moments like that, is that, that the person, it's possible they might be offended. But if they are, they're still going to understand at some level that it's coming from a place of care and concern. Now, we could get into analyzing all kinds of different relationships and say there might be some circumstances in which a person might feel like they were being controlled or someone was trying to control them with questions like that. Even in those cases, even if you're absolutely sure the person is not going to take it the way you intend it, their well-being is still the most important thing.
Okay. So say, that we've realized that we may have an issue. We've talked about the different signs to look for in ourselves as well as in others. What can someone do to cope with these feelings or overcome them? How can a person, I guess, engage in self-care?
Yeah.
In an effective way.
Right. Well, so one of the things is to become educated and start with those big three, sleeping, eating, and activity, and physical activity. And learn, what are the generally healthy guidelines for human beings with regard to those things, and then try to make adjustments to align more closely with what is healthy for us. And also, it's important to develop a certain degree of self-honesty and self-awareness. I think this is where the contemplative practice that you talked about earlier really does come in as an aspect of mental health. That practicing self-awareness is a contemplative activity, and it is also a mental health activity. There's huge overlap between mental health practices and contemplative practices. This doesn't mean that if you're not meditating, you can't be, a healthy human being, a psychologically healthy human being. Of course you can. It just means that there are some basic skills involved in a contemplative lifestyle that everybody who wants to be mentally well is going to be doing. So paying attention to your own thoughts, paying attention to your own moods, being aware of how you're reacting to things. And is this reaction really about this, or is it coming from somewhere else? Why am I reacting the way that I am under these circumstances? And a lot of us haven't been taught to question ourselves. In fact, we've been taught not to question ourselves. We've been taught to assert ourselves without questioning. And so particularly, like, for example, with anxiety, if anxiety is leading individuals to come to lots of conclusions, to jump to conclusions about potential risks in their life that they need to get ahead of and that they need to beat, and you try to confront that, well, then, they may regard that confrontation as itself part of the problem that they need to overcome. And so these things can get complicated, but we have to be able to release our concerns about what other people think, whether it's with self-care or whether it's with reaching out to another individual. We have to recognize that our presence in the world, our presence for ourselves and our presence for other people, demands that we begin with this attitude of care and compassion and concern, or what we talk about as brotherly love, relief, and truth, as the principal tenets in Masonry. That's where being a healthy, well-functioning individual and member of a community begins.
So the one thing I want to bring up here too is, say self-care is not enough, right? And I know especially in society, and we've already talked about the impact society and cultural norms has with us, that can be detrimental.
Yes.
Therapy is considered negatively by a lot of people.
Yes.
So what are your thoughts of the effectiveness and impact of therapy, and how do we overcome those negative connotations to use it in a constructive way when appropriate?
Yeah. Well, so let me just first say that as a person who's made a career and a profession in mental health, I'm not going to say I don't think it's effective. My experience has proven to me that that therapy really can be very helpful. And thankfully, one of the things that has happened during my lifetime is that stigmas, particularly in the last, I'd say 20 years or so, 25 years, the stigmas about going to therapy or seeing a counselor or going to a psychiatrist, those stigmas are not nearly as strong, as widespread, or as insurmountable as they used to be. There's been so much information about mental health distributed to the public over the last couple of generations, that people are recognizing that, yeah, it's probably a good idea to consider therapy if I'm not coping well, if I'm not getting what I want out of life, if I'm not being the person that I want to be, if I don't have the relationships that I want to have, then maybe going to a professional is a good idea. And so what I would say is just think of it as like you would any other situation. You know, if you've got anything else in your life that's not working the way that you want it to, then there may be some things that, you know, you can DIY, but at some point, you know, unless you're a trained auto mechanic, you're not going to be able to repair your own car in some cases. You're going to have to go to a professional. And even if it's just to learn something that you can then DIY. And often that's what therapy really is about learning things in the process of talking with the therapist that you then go out and do in your life and try and practice. And then you come back and you talk about what that was like. And it's not like the therapist is necessarily telling you how to be or what to do or who to be. It's like they're going through this process of looking with you at what's working and not working in your life. You know, Dr. Phil has got that great question. How's that working for you? You know, that's a really great therapeutic question. Mm-hmm. And that's a huge part of what therapy is about. It's like what's working and what's not working, and how can we change things to make things work better. And so a therapist is just going to be someone who has some experience and some skills and training about how to go through that process of learning and growth and finding your own solutions to being the person you want to be and having the life that you want to have and the relationships that you want.
So kind of like introspection with a guide or with an assistant.
Yeah, that's it. A good therapist knows that they're working for you, that you're the boss. Mm-hmm. And I tell my clients this all the time in our first conversation, that I want them to know that I work for them, that, you know, that they're in control, that if they don't like an idea that I'm putting forward, or they don't think that something I'm suggesting as a possibility will work for them, then say so. And we'll talk about that and see if there might be a different approach that suits them better.
Okay. So, and I think that may be something that some people see this as, I'm going to talk to this person, they're going to tell me that I'm crazy. And they almost see it as an adversarial relationship.
Yeah. I think that's one of the reasons why maybe that the stigmas existed more in the past than they do now, is because the field of mental health profession has changed in its attitudes about how it works with people. Mm-hmm. You know, counseling and therapy really did used to be more of a diagnostic process in which, you know, a professional listened to what you had to say and then said, okay, your problem is you have this, and they labeled you with something.
According to the DSM, here's what's wrong with you.
Yeah. And sometimes that process can be helpful, but most of the time, what people really just want to do is they want to find some ways to make some changes in the way they think about things, in the way they react to things, in the way they behave, so that they can just be happier. That's it. That's really all that most people want. And a good therapist understands that and is not going to be interested in trying to make you feel worse about yourself.
I think some of the negativity could also be that some people have this expectation that they're going to be put on something, that I'm going to talk about my problems. They're going to give me a happy pill. Mm-hmm. And they don't want to have that crutch, I guess, or they're concerned about what kind of
Yeah.
impact it would have. But I think it's important to realize there is a difference between a therapist, psychologist, and a psychiatrist.
Yes, good point. Yeah.
Um, yeah, and I guess, do you want to kind of elaborate as to what the different roles are between them?
Sure, I can talk about that. So when we talk about therapist is not really a kind of legal term in this field. It's an umbrella term that really covers all kinds of different professionals who deal with mental health.
Mhm.
And so, we might be talking about social workers. Some social workers are licensed master social workers or clinical social workers, and depending upon which state you're in, the license can change. But generally, social workers who are providing therapy have a master's degree, and they have completed supervised hours, clinical hours, doing practicum and internships and that sort of thing to be able to function as a fully licensed therapist. Licensed professional counselors are therapists. That's probably the most common licensure term for counselors. Licensed marriage and family therapists. They're really focused specifically on marriage and family issues, obviously. So there's a really broad range of things that fall under this most basic level of therapist. You would include psychologists and psychiatrists in that umbrella. When you get to psychologists and psychiatrists, now you're talking about people that must have doctoral degrees. Mm-hmm. Other levels of therapy generally require a master's degree. Some of them will accept bachelor's degrees. There are certain kinds of chemical dependency counselors, for example, that only require bachelor's degrees. Some kinds of social worker licensures only require bachelor's degrees. But they have very limited scope of things that they're legally and ethically authorized to assist with. With a psychologist at that doctoral level, it's common now for them to be able to prescribe certain medications.
Okay.
But psychologists are often more interested as a profession in dealing with things from a legal issue, so the legal side of mental health, and they're often called upon to testify in court. They're often called upon to make diagnoses in really confusing cases sometimes, or cases where it's difficult to rule out one diagnosis versus another. That's not uncommon, in fact. But they also have all of the training that master's level therapists have in being able to provide the kind of dialogue interaction that goes on in most counseling and therapy. With psychiatrists, they're really medical doctors who know more about neurology and medications and the intersection of the body and psychology, mm-hmm. and particularly, the brain and the central nervous system. For the most part, psychiatrists generally serve in the capacity of doing diagnostics and providing prescriptions for medication. Some psychiatrists will also do talk therapy, like master's level therapists and psychologists, but more often than not, in today's world, they will refer their clients, their patients, to psychologists or master's level therapists for the talk therapy, and they do the medication management.
Okay. So kind of a pharmacological approach as opposed to a counseling approach.
Right. And statistically, it has been shown that for people with major depression, for example, that an integrated approach of using both medication and talk therapy is generally more effective than either alone. Mm-hmm. But that's not the case. On a case-by-case basis, for each individual, things may be different. Mm-hmm. For some individuals, talk therapy may be exactly what they need, and medication may, in fact, be contraindicated. It may not be a good idea to put a certain individual on medication. Mm-hmm. And so, to get back to something you were kind of alluding to earlier, going to a therapist, particularly a master's level therapist like a licensed professional counselor, like a licensed clinical social worker, you don't have to be concerned that they're automatically going to be trying to get you on medication.
Right. Okay. And I think that's important because, again, the social stigmas that are out there is, if you have to take mood altering or mood leveling medication, there's something wrong, right? And there are times when it is absolutely necessary and it's going to improve the quality of life.
Yeah.
I think if anyone is having problems, right, and it's not, life-threatening, you should obviously seek help immediately. Mm-hmm. But I think counseling is, I'm glad to hear that it has started to lose its stigma, but I feel that the important thing to take away from this is that if you're afraid to see a counselor for whatever reason, there's no reason for that fear. They're not going to drug you up. They're just there really to kind of talk through things.
Yeah. Yeah, exactly. Yeah. And if you're afraid to go see a counselor, then maybe you ought to ask yourself, what does that fear itself indicate about what's going on in your life? Mm-hmm. If you're even considering the possibility that you need to go to see a counselor, or someone has suggested that, and your reaction to that is fear, mm-hmm. or anger, or anxiety, or worry, then maybe that's just more evidence that it might be a good idea for you to actually talk to somebody who does that for a living.
Right. I had a grandmother that, my grandmother used to tell me that she didn't like going to the doctor because she didn't want to find out anything was wrong. And it's like,
yeah,
something's wrong, and that's why you don't want to go.
Yeah, exactly. Well, and one of the other things I will say is, another thing that keeps people from going is, let's talk. I think this is probably a good idea to talk about some of the stigmas a little bit more.
Okay.
So one of the things is, what are other people going to think if they find out that I'm going to therapy? And, people will be concerned that other people may think now, okay, if I'm going to therapy, other people are going to think I'm not going to be reliable. I'm not going to be dependable. I'm not going to be safe to be around. I'm somebody they're going to have to worry about in one way or another.
Almost like it's a character flaw.
Yeah, a character flaw, or now I've become like this fragile eggshell that they have to, be super cautious with. And, so there's that concern. What are other people going to think if they find out? And then another concern at a really tangible level is the money.
Yeah.
And unfortunately, it is a profession. Therapists are trying to support their own families and have their own lives and do something that they regard as good work in the world, and also being able to benefit from that. And so it can be expensive. And not everybody has insurance that will provide a significant mental health benefit as part of their insurance package. It's important for people to know that there are resources available for people who have financial concerns about counseling. Many counselors have sliding fee scales. Mm-hmm. So they'll find a fee that works for you. I should say therapists, not just limited to counselors, but also social workers, psychologists, psychiatrists will have these. There are even some therapists out there who will just work on a kind of a donation basis. Mm-hmm. That their clients just pay them what the clients think it's worth. That's rare, but there are people like that.
Well, I did want to bring up too on the medical insurance part. I think it's important that before you feel that it is out of range, that you actually investigate, because you may be pleasantly surprised. Some medical plans are realizing that having good mental health is, in the long term, it's money saving to the company and to the insurance company themselves. So my wife and I, whenever it comes time for benefit renewals, I always compare side by side. And I've noticed, like, her insurance company, it's not the greatest if we have to go see, our regular doctor, but when it comes to mental health, it is fantastic.
Yeah.
She has Aetna, and I believe under her plan, it provides 26 sessions a year at no charge.
That's
if you need
exceptional.
Yeah. So I think if you feel that you need therapy, you may want to check the benefits of your insurance, if you have insurance, before you rule it out.
That's right. Yes. And often those employer-based insurance plans connect with what's called an EAP, an employee assistance program, which is exactly what you said. It's intended to work within the context of the employer, demonstrating, ideally, that the employer recognizes that the mental health of their employees is good for their business and good for the work environment, and just that there are all sorts of benefits that come from that. Mm-hmm. Like insurance plans can differ from each other, and some can be really good, and others can be mediocre, and others be really poor. The same is true for employee assistance programs. These are things that people need to educate themselves about as members of this society that we live in.
But before you rule it out, take a look.
Absolutely.
Okay. So one thing I'd like to talk about also is, and this is what really kind of brought it home to me that this may be a good topic to talk about, is being around others to help with our own mental health, I guess. For me, and I know we've talked about this before, I lost my mother when I was worshipful master. Going to lodge helped. It break the monotony. It gave me a help distraction that I didn't just sit at home and dwell about it. Mm-hmm. I could kind of take that off my mind for a little bit. My father just passed away a couple of months ago, and it was the same exact thing. I could go to, I can go to lodge, or commandery or what have you, and not think about it, which was a great relief in itself. Mm-hmm. So the question I have is, going to lodge or increasing any social activity, can these be valid coping mechanisms for some people, right? It's not going to work for everybody, as we talked about before.
Right.
But is this a possible outlet that people can use to help?
Yes, absolutely. In general, being engaged with other people in activities that you regard as important and meaningful is going to contribute to your mental well-being. Whether that's going through a grieving process. The grieving process, by the way, that's not mental illness. Some people sometimes get that idea that grief is somehow a kind of sickness, and it's not. It's a healthy thing to go through. But we also need to have other aspects of our life present. And so being involved in things that we regard as meaningful, worthwhile, and beneficial. Like maybe it's our jobs, maybe it's masonry, maybe it's church or some sort of a club, a special interest club of some sort that a person belongs to. But social interaction is itself part of our well-being, one of the keys to our well-being. Now, for some people, that can become not just a temporary respite from, for example, the deep grief that one feels when they're alone and nothing is going on. They've just lost a loved one, and in that moment, the grief is really present with them. Mm-hmm. So we can have respites from that. But when we start to use those social things as escapes, as part of a process of avoiding ever dealing with our grief or ever dealing with our depression or ever dealing with our anxiety, if we're just trying to escape through these other things, then they actually become part of the problem. Mm-hmm. They're not balanced out by the other ways of doing self-care.
So, like a bill that's come due, you can delay the processing, but at some time you have to deal with it.
Really great analogy. I'm glad that you said that. Yes.
Okay. So, we talked a little bit about suicide and, the need to be direct if we feel that someone may be having those kind of thoughts. And we've talked about some of the signs. However, how can we seek help for ourselves or others if we believe that they may be at risk?
Yeah. So there used to be, there still is, a national suicide helpline. What it used to have was that long string of numbers, that we always see whenever it says, if you need help, call blah, 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 blah. Well, I may be in such a state that just being able to remember those numbers or write them down may be well beyond where I'm at. And so finally, they came up with a 3-digit number, 988. It's a great resource. You yourself don't necessarily have to be the person in need. You may just be like out of sorts in terms of how to help somebody. And so I would encourage you to reach out. If you're in a situation where you're feeling a little panicky about what to do, then take advantage of that same number. Mm-hmm. But if you're not in that condition, if you're just thinking, I'm kind of concerned about this person in my life, and I really would like to know how to be a better friend or family member to that person, get online and do some study. Just start typing things into Google and look for, what would be reputable resources like of course, at this moment, my memory is short circuiting here, but the National Institute on Mental Health, for example, go to government resources. You're going to find really reliable information there. Go to like your county agencies. A lot of times will have good resources, mental health and mental retardation agencies, for example. And there's a world of good information out there on the internet, and just use a little bit of discretion about thinking about the source, and you're probably going to find good stuff. Psychology Today is a great website that not only can you get good information about mental health, but they have a therapist finder platform that is excellent. You can go in there and look for therapists that have all kinds of different criteria that you can filter through them to find exactly the kind of therapist you're looking for, the person that you would want to talk to in your area, someone that could be convenient for you to get to.
So what I'm hearing is Reddit, may not be the best place to
No, I
try and
would say
self-diagnose.
in general, don't rely on social media.
Oh, all right. Well, so, uh, Brother Chuck, I want to say once again, thank you. This has been a very enlightening experience. I think, again, I think a lot of people may have concerns about this or may, um, in this moment, I think it's more important than most others that we're aware and cognizant of the issues that may present themselves, especially when it comes to mental health. Um, so as we wrap up, I did want to ask, are there any announcements or anything that you would like to give, or maybe appearances that you're going to be at? I know there's a contemplative workshop that's coming up in the area.
Yeah, that's right. Yeah, District 64B, I think it is going to be having a workshop, a contemplative workshop, coming up in February, the first Saturday of February. It's going to be a morning workshop, and Brother Chuck Springer is the one who is organizing that. And I know he's got some advertising materials, marketing materials out about that, particularly on Facebook. But any Mason who's interested can certainly reach out to Chuck Springer and in this area to find out more about it. I've got lots of workshops and retreats. I'm actually moving away from doing the old style kind of just lecture presentations that are followed by question and answer, and moving more into doing workshops and retreats to help Masons learn how to actually use contemplative practices for their own well-being, as well as to be better friends and family members to others, and to get more out of Masonry, essentially, because isn't Masonry really about those things?
Yeah, absolutely.
And so, I've got a lot of those coming up in the year, and I won't take up a lot of time with listing off what all those are. Generally, if you want to know, you can, and you're on Facebook, you can find out that way. I do want to let your listeners know that I now have a third book that will be coming out. So my first two books, the first one was Contemplative Masonry, which was about individual practice with regard to Blue Lodge Masonry and how you could bring contemplative practice and Blue Lodge Masonry together to enhance your own life or your own experience of Masonry. The second book was The Contemplative Lodge, which is really about how a lodge or a group of Masons, not necessarily a lodge, but how a group of Masons can work together, can do contemplative practice together. And the third book now moves from the Blue Lodge into the Scottish Rite, and it's called A Rose Croix Oratory. And it is about the 18th degree of the Scottish Rite and the Knight Rose Croix degree, and about how that degree intersects with the philosophies and the practices of Rosicrucianism, and Rosicrucianism as an esoteric tradition that has a lot of intersections with Freemasonry, and more than one scholar has speculated about Freemasonry actually having been inspired by Rosicrucianism. The speculative Masonry that we know of today was inspired by Rosicrucianism. And I will be talking about how you can do contemplative practice within that mixture of Rosicrucian and Masonic traditions, and the benefits that it offers to your life.
That's fantastic, actually. And two subjects that I am extremely interested in, both contemplative practices and Rosicrucianism. So, an additional concern with possible issues of depression and anxiety there may be other conditions that will also create issues with either mental health or maybe exacerbate existing issues. And so you wanted to talk about drug use and alcohol use and how they may impact mental health.
Right. Yeah. So one of the things that, we touched upon earlier was how, common, ordinary substances that we all enjoy, sugar, caffeine, energy drinks. Maybe not everybody enjoys energy drinks, but, these are things that many of us use from time to time, and some of us more often than time to time, to cope with life, to try to be more effective in life in some way, or, have more energy and so on. Well, and I mentioned in that moment how THC, sometimes people will use marijuana as a sleep aid, but that actually it interferes with the ability to experience deep sleep, that deep restorative sleep. Well, in very similar ways, many of us turn to alcohol and other substances to try to be happier, be more effective in life, more productive, to relieve stress, and so on. And it's true that a certain degree of alcohol use is not a bad thing. I mean, there's actually some health benefits that come with certain kinds of alcohol consumption, but every good thing can be done to an not good extreme. And so when we talk about looking for behavior changes as clues to problems that might exist for a person that we care about, or for ourselves, hopefully we care about ourselves, then what, if any, changes might have happened with regard to a person's use of a substance like alcohol or THC or something else? Mm-hmm. Has it become more common? Are larger quantities being used? Those are, pretty good signs that a person is not coping well with whatever internal or external struggles they may be facing in their life at that moment. And some of those things can increase gradually over time, so that it sometimes is not really noticeable, mm-hmm. or use of those substances in those ways, heavy use of those substances in those ways, may be part of a person's own particular cultural milieu. They may have been raised in a heavy drinking family, for example. And so the drinking itself may not seem to be symptomatic of more serious underlying issues, but it may be contributing also, even though the drinking itself hasn't changed, it may still be contributing to problems. If we're talking about routine intoxication, whether that is something new or whether that's something that's been ongoing for a long period of time, then there's probably some issues to be concerned with beneath that superficial appearance.
So like everything else, it's everything in moderation. And depending on the substance will depend on what is considered moderation, right?
Yeah, the substance and the individual. Yeah.
Well, and with alcohol, I think it is easy for some to slip into that, because alcohol, out of the available drugs out there, alcohol is considered the more socially acceptable one.
Right.
Right. It's okay to go out and have a drink every once in a while, but if that drink then goes from being an item of enjoyment to becoming a crutch that you need to get through the day, then that's when it becomes problematic.
Yes. Yeah. And it has long been part of our culture that, particularly with alcohol, By the way, these things also apply to nicotine. Haven't mentioned nicotine, but they also apply to nicotine. But particularly with alcohol, this idea of coming home at night and having a few drinks to relax, right? That in itself can be problematic because we've already made the association with I need the alcohol to relax. Mm-hmm. Or even if I won't say that I need it, I at least acknowledge that it is my go-to means for relaxing. And when that's the case, then we need to take a really more serious look at what's going on in our life.
Now, with all of these items, even with food, right? And alcohol, THC, maybe harder drugs, cocaine. Some people, I've known people who have used all of them throughout my life, friends that I've had. And I had a couple of friends that say that when they have a problem with it, they recognize it because a little is no longer enough, that they have to use a little bit more. And then they have to use a little bit more. I had a good friend who, he was a habitual cocaine user. And he told me that the one thing that he regretted about it is even when he stopped, he felt like it was harder to achieve the highs that you would naturally get, almost like, like eating too much sugar and it's linked with diabetes, that he felt that it was very similar in that, I guess, triggering the dopamine or, the other pleasure centers of the brain, that repeated use made it to where he had a higher tolerance for it. And it took more. And so if he wasn't taking the drug, it was hard to feel happy. It was hard to feel good. Is that an actual risk, or is that something that he was just, it was that kind of a psychosomatic symptom that he was feeling?
Well, depending on the substance that we're talking about, I know you're mentioning cocaine in this particular instance, but depending on the substance that we're talking about, it can be either or both of those things. You can develop a kind of tolerance at a physical level that requires larger and larger doses, but you can also develop a kind of experience with the mind-altering effects of a drug that then is its own kind of tolerance. It's like, okay, I'm used to that. I think I can handle that. Maybe I can go a little farther. And so there becomes this pattern of using something to get farther and farther and farther into what are perceived to be desirable effects, but have ultimately detrimental.
So it is possible to have a physiological addiction as well as an emotional addiction, that on one level, I have to have this, otherwise I feel withdrawal or whatever. And then on another, I feel like I have to have it.
Yeah. This is particularly true with alcohol. I mean, most people know what the DTs are. Delirium tremens, this sickness that people who are genuinely physically addicted to alcohol experience whenever they begin to sober up and alcohol starts to leave their bloodstream. They get physically ill. They experience shakes, sweats, they may hallucinate. They have strong mood swings, may be very delusional even. And so these are all symptoms of the physical consequences of an addiction to alcohol, of having it in their system so much that their system has adjusted to it. Yeah.
Okay. So we've talked about alcohol, THC, and you also mentioned nicotine is one that a lot of people don't think about. And I know there's been a campaign especially to bring up the awareness of nicotine and, even in the form of vaping, that was considered kind of a socially acceptable alternative to smoking.
Right.
But it's come around of course, that there are negative effects to that as well. Are there any other substances that you feel people should be aware of in that they don't slip into abusing them, that it's kind of an easy slope to get into because it feels like it's okay?
Well, I think we've mentioned them at some point or another. I mean, sugar is certainly one. I mean, there's more and more research about just how powerfully addictive sugar is, and mood altering, mind altering, even sugar is. You know, when I was growing up, nobody thought about sugar as being in the same category as, you know, opiates or alcohol or something like that. But the more we study it, the more we realize that it really does have those kinds of effects on us, particularly if we abuse it in large quantities and frequently, which most Americans do. And so sugar is one, and I've mentioned energy drinks, and there are all kinds of different chemicals that are used in energy drinks. I mean, we typically think of caffeine, but there are others. And rather than go down a list of what all those are, because frankly, I don't know what they all are, but rather than go down a list of that, we just say that using energy drinks is exposing yourself to chemicals that may or may not be physically addictive to you, but can definitely have the potential of creating at least a psychological dependence.
So I feel like the important lesson here is we should be aware, right? That especially what we put in our bodies, because it may have an unintended consequence.
Yeah. Yes. And, you know, you mentioned earlier moderation in all things, and I think about that Masonic principle of temperance, that virtue of temperance. And of course, it's easy to think of that in terms of alcohol because we can recall the temperance movement and so on. Right. But it's that idea of being moderate and recognizing that the middle way between extremes is where health and virtue and well-being lie. And then the virtue of prudence is the ability to think ahead about the actions that I'm doing now and foresee as well as possible, as clearly as possible, what the benefits and consequences really are. And so we're talking about using Masonic principles here when we're talking about exercising self-care, and especially with regard to the use of substances.
And I guess fortitude will also fit in there too, right? The fortitude to say no to all these things you personally enjoy, right?
That's right. To persevere, right? Yes, to stand up to the temptation, right?
Or else you'll have to deal with justice in one way or another, right? Hopefully not legal justice, but your body may impart its own sense of justice.
That's exactly right. One way or another. What is due will be paid.
Well, and it's like the in Scottish Rite, it talks about the importance of equilibrium, especially in the higher degrees.
Yes,
and that's part of this as well.
Yes, that's absolutely right.
Okay. Now, so there are some resources that you shared with us that we are going to make sure to include with the description of this podcast episode. Did you want to touch upon those as well before we end the?
Yeah, I will just say that the resources that we're going to provide links to in the notes for this episode are really reliable ones. You know, I was talking earlier about how important it is to be educated, but, you know, also to make good decisions about what you look to, what resources you look to. And so let me just kind of talk about these. I'll just list these off as some of my favorites and most often recommended. First, I'll go back to that number 988, the Suicide and Crisis Lifeline. They also have an online chat function and we'll provide a link to that. But you can go to their website. You can just put in 988 in any search engine, and it will take you to their website. Of course, 911, if you're in a situation where someone is, that they're in immediate danger to themselves or to someone else, please call 911. NAMI, N-A-M-I, the National Alliance on Mental Illness. That's the nation's largest grassroots mental health organization. And we'll have links there. Their website is NAMI.org, N-A-M-I.org. And the National Institute of Mental Health, NIMH, is the lead federal agency for research on mental disorders. And their website has a lot of resources for education, learning more about mental illness. The National Alliance on Mental Illness also has a lot of those sorts of things. And they're not just talking about things like depression and anxiety and suicide. They're also talking about substance abuse on those sites. And finally, I had mentioned Psychology Today at psychologytoday.com. It's the world's largest mental health and behavioral destination online. And as I mentioned, it's a great place to look up to find professionals that might be helpful to you.
Okay. One last thing before we wrap up that I did want to touch upon is we had spoken earlier about employee assistance programs, right?
Yes.
EAP programs that a lot of employers have. Now, if I remember correctly, when I used to have a team that I managed, of course, they gave us training on this, and we had to be aware that it was available, when to offer it, if we thought that an employee needed it, when we could, just kind of slip them the information. I think the important thing, though, that people should be aware of is if you use EAP, the information that you give is confidential.
Yes.
And because I know a lot of people would have concerns about using EAP, especially for cases of substance abuse. But I think it's important for people to realize that this isn't a way to kind of ouch you, that
right.
It really is intended as a way to give you the help you may need.
Yeah, I think that's an excellent point. The professionals that provide the services for EAP programs typically do not work for the employer. They're contracted by the insurance company to provide the services. And each of those therapists or professionals of whatever sort in the EAP program, but we're talking therapists here, each of those therapists has their own state licensure. And the laws and professional ethics dictate that they maintain confidentiality and that they cannot share anything with the employer that you don't want them expressed in writing to share. And so, yeah, your privacy and what you say in those sessions is guaranteed by law.
Okay, and it's available not only for issues with depression and anxiety and substance abuse, but also marital counseling.
Yes.
Or if you need assistance, if you're going through the adoption process. I mean, there's a wide range of resources that are there available for you.
Health and fitness, even.
Okay. Thank you so much again, Chuck, for joining us. I really appreciate it. Thank you for your friendship, your insight. It's always valuable. Is there anything else that you think we need to bring up?
I think we've covered it.
Okay. All right. Well, fantastic.